Let's move on to physiologic changes in pregnancy. There's a lot, so we have 2 cards devoted to this. I'm not going to go super in depth. I'm just going to point out a few things here. Cardiovascular status. The patient's blood volume is going to increase by almost 50%. So things that can come along with that are going to be things like edema, right? We have more fluid, we can have swelling. A little bit of tachycardia is normal and expected because it's hard for that heart to pump fast enough to keep up with the cardiac output of all of this fluid, right? I got to keep it moving. So that's where we're going to have that tachycardia. Now, because I have dilution of my red blood cells from the plasma volume, you're going to see dilutionally low levels in the lab work. So hemoglobin and hematocrit are going to drop slightly. That's normal. We don't consider a patient who is pregnant to have true anemia unless the hemoglobin is less than 11 grams per deciliter in the first and third trimesters or less than 10.5 in the second. But point being, it is lower than a non-pregnant patient. You'll see a lot of different things on this card. Musculoskeletal, the body is creating a hormone called relaxin, which thankfully does what it sounds like. It helps to relax the ligaments and everything like that are holding everything tightly so that when labor happens, there's enough relaxation in these joints to allow for this movement. But it can lead to things like clumsiness and incoordination, which would be why when I was pregnant, I fell down the stairs 3 times because my body was very uncoordinated thanks to all of that relaxin. So then on the second card here, a few things I want to point out, and there's a really, really big one here. It's that because this uterus is so big and so heavy, if I lay on my back supine, what is underneath all of that? Think about it. It's going to be the inferior vena cava. And the inferior vena cava is where all of the blood from my lower extremities and everything is being returned back to my heart. If I lay on my back with a really heavy uterus, a gravid uterus, and put pressure on that vena cava, I'm going to cause a traffic jam, right? First of all, so that blood's not going to be getting back appropriately. But then what else is going to happen? I'm going to have hypotension. My blood pressure is going to drop because I'm not getting enough blood back to my heart. And so I end up with this hypotension. This is called supine hypotension syndrome. And very easy way to combat it is don't lay on your back when you're pregnant, or if you need to, put a pillow under one hip so that we are just slightly rotating to move that uterus to the side and make sure that we are getting that good blood return. Other things on here are going to be things like constipation, nausea, and vomiting, right? All of those things are going to be very common in pregnancy. And then under the integumentary heading, we have a few things here. Cloasma. This is oftentimes called the mask of pregnancy, and it's kind of a little discoloration of the face. Then we have striae gravidarum. Striae are stretch marks, and gravidarum means related to pregnancy. So those are just pregnancy-related stretch marks. And then we have the linea nigra, or linea nigra. Literally means black line. So this is going to be a darkening of the abdomen, and it's a vertical line, usually running down the pregnant belly. Some people get it, some people don't. Same for all of these. It's not a good or a bad thing. It's just a thing that can happen. So it's good to be able to educate your patients. Okay, that is